flexors are one of the most common indirect causes of low back pain that we see in our office. And this is because of where the hip flexors lie. So the hip flexors originate from the front of the lumbar spine, travel down through the pelvis, and attach to the front of the hip. So a lot of times when they're tight, they pull the spine into extension, and this compresses the joints in the back of the spine. So a tight hip flexor can lead to low back pain. So today we're going to show you how we examine the hip flexors, how we treat the hip flexors, and that low back pain that comes along with it. And lastly, we'll show you a good stretch you could do at home to treat that hip flexor tightness right at your house. So there's one main test we use to determine the status of the hip flexor when we're evaluating a low back patient. And it's called the Thomas test. So it's very simple. The patient's lying on their back. We're going to ask the patient to bring their left knee to their chest and pull. We're actually looking at the right knee. We're looking to see if this comes off the table here. So in this case, it did not. So this hip flexor we know is in a good position. So come on down for me. Let's pull that right knee off the table. So we're looking at the status of the left knee. And you can see how that left knee actually there lifts off the table a little bit. I can slide my hand right under here. That's a good indicator that the left hip flexor is a little tight, and it could be tugging on that side of the front of the lumbar spine. This is how we're going to treat the low back pain. Remember, the hip flexor is a cause of the low back pain that we're going to address later with exercises, but we still want to make sure that those joints that hip flexor is pulling against are freed up and they're moving properly before we rehab that hip flexor. So we're just going to adjust the low back here. So you're going to lay on your side. Great job. Hands up towards me. Shoulder, elbow. Nice and relaxed. Relax your top shoulder for me. Good. Any pain with that?
No.
Beautiful. Come right on your back for me. Next, we'll just adjust the hip joint. So, Elvin, if you could scoot over to the right of the table for me. Beautiful. So you're just going to hold the side of the table. And this is going to be like when you crack your own knuckle and you give it a pull, except we're going to do it on a grander scale with the hip. So hold the side of the table with both hands here. Beautiful. And just give me the whole weight of your leg. Nice and relaxed. Good. Relax. Relax the leg. Relax. Good. Beautiful. A lot of times the patient will feel a nice pop from that pull. And it's not necessarily we're looking for the pop, but when it does pop, it feels pretty good, right? All right, guys, I'm going to show you a quick at-home stretch you could do for your hip flexor, and I'm sure you've seen this stretch a million times at the gym and on the athletic field, but sadly most people do it incorrectly. So remember what we talked about at the beginning, where the hip flexor originates from. It actually originates from the front of the lumbar spine, okay? The lumbar spine is a very mobile segment. So if you're not controlling your core and you're pulling straight out like this, your lumbar spine is starting to bend, okay? So we don't want the spine to bend as we're leaning forward, right? We want the spine to stay nice, straight up and down. The way we do that is we contract the core. So I always tell my patients, brace yourself like someone's about to punch you in the stomach, okay? I'm not holding my breath. I'm just squeezing my core. Once I find that, I just lean forward, push my belt buckle parallel to the floor, and I get a nice stretch right in this front pocket. Okay, so we just want to make sure we're engaging that core. And if you want to get a little oblique stretch in there, you can come up and around like this.